name is Kelsey Gesling. I'm a graduate nursing student at West Texas A&M University. I'm going to be performing a head-to-toe assessment on a 25-year-old male patient who's come in for a general physical exam. Prior to this, he's completed the general survey. We've gone over his past medical history, surgical history, allergies. He has no known drug allergies. I've already obtained his vital signs, which were all within normal limits. I've gotten his height and his weight. I have also tested his optic nerve, cranial nerve number 2, with the Snell and E chart, and everything was normal. I've washed my hands, and now we're going to get started with our head-to-toe assessment. So first, I'm just going to start with general inspection of the head and neck. I'm going to start by taking a look at the scalp, feeling the texture of the hair, making sure that the skull feels nice and intact. There's no bony nodules, any lesions I should be concerned about. I'm going to move on to checking the bilateral temporal pulses, making sure they're 2+ and normal. I'm going to palpate his frontal sinuses and his maxillary sinuses, making sure that there's no tenderness felt there. I'm going to go ahead and test cranial nerve number 5, the trigeminal nerve. Can you tell me if you feel sharp or dull?
Sharp, dull, sharp, dull, sharp.
Great. While I'm here, I'm also going to make sure that the eyes look nice and symmetric, the ears look symmetrical, the nose and mouth are in midline. I'm going to go ahead and palpate his temporomandibular joint. Can you open your jaw for me? I should be able to fit about 2 to 3 fingers behind his jaw here. Okay, go ahead and close your jaw and move it side to side, making sure I don't note a significant amount of clicking or any difficulty with that. Perfect. Throughout this assessment, I'm going to be checking hair distribution, skin color, making sure that there's no significant, any kind of moles or nevi, looking for any kind of lesions or discoloration. I'll also be checking the color of the nail beds, looking for any kind of clubbing on the toes or the fingers. So now we're going to go ahead and move to the eyes. First, I'm just going to assess pupillary response, checking direct and consensual. So can you just look ahead for me? We're looking at direct and consensual, and direct and consensual. Perfect. So now I'm going to go ahead and test accommodation. So can you look at my pen light and the back wall? Pen light, back wall. Perfect. So now I'm going to test cranial nerves number 3, 4, and 6, oculomotor, trochlear, and abducens with the 6 fields of gaze. Can you follow my pen light without moving your head? Great. Just looking for any kind of nystagmus or a jerking of the eye movement. So now we're going to go ahead and take a look at the optic disc, at the red reflex, looking for any kind of papilledema or abnormalities in the optic disc. I'm going to brace my hand against the patient's forehead just for stabilization. Good. And we'll do the same on this side. Perfect. So everything looks good with the eyes. I'm going to go ahead and move on to the ears. So once again, just making note that they're nice and symmetrical. I'm going to palpate the auricles of the ears, making sure that there's no nodules or anything felt abnormal. I'm going to go ahead and take a look at the inside of the ears, looking at the tympanic membrane, making sure it's nice and clear, that there's no signs of red or bulging signifying any kind of infection. So for an adult, I'm just going to pull up and back. Good. Tympanic membrane looks great on that side. I do note some sebum wax, but nothing abnormal. Great. So now I'm going to move on and test cranial nerve number 8, the acoustic, with the whisper test. Can you just repeat what I'm saying?
66.
Good.
55.
Perfect. Finishing up with the ears, I'm going to go ahead and do the Weber and Rhine test. With the Weber test, I'm going to test lateralization, making sure hearing's even on both sides. Can you tell me if you feel this evenly? And now we'll go ahead and do the Rhine test. We're going to test air to bone conduction, which should be 2 to 1. So just let me know when you quit feeling or hearing the vibrations. Perfect. Now that I'm finished with the ears, I'm going to go ahead and take a step back to the eyes really quick. I just want to make sure that I go ahead and assess the conjunctiva and the sclera of both eyes, making sure that the conjunctiva is nice and pink and that there's no yellowing signifying any kind of liver disease or dehydration in the eyes of the sclera. So now we'll go ahead and move on to the nose. First, I'm just assessing the nares, making sure there's no septal deviation, that it's nice and midline. I'm going to test the patency of both nares. Can you take a nice deep breath? And once again. Great. Can you close your eyes? I'm going to test the olfactory nerve, cranial nerve number 1, on both sides. Tell me what you smell.
Alcohol.
Okay. And again.
Alcohol.
Great. So now I'm just going to take a look on the inside of the nares, making sure that I don't see any kind of nasal polyps, making sure it's nice and moist. Okay, perfect. Just keep looking up for me. Good, and everything looks great there. So now we're going to go ahead and move on to the mouth. First, I'm just going to take a look at the color of the lips, making sure they're nice and pink. I'm going to have the patient open his mouth. Okay. I'm just taking a look at the oral mucosa, making sure it's moist, pink, that there's no kind of ulcers. Can you lift your tongue for me? Good. Making sure that the vascularization under the tongue looks good. There's no cancer lesions. And you can lower it. And looking at the soft and hard palate. I'm going to go ahead and test the gag reflex. Good. And the patient responds appropriately. Just making sure that cranial nerve number 9, the glossopharyngeal nerve, test correctly. So now I'm going to go ahead and have the patient stick out his tongue and say ah. Do it again for me. Great. Making sure the uvula rises nice and midline, and that's testing the vagus nerve, cranial nerve number 10. So go ahead and protrude your tongue for me. Good. Let me see each side. Great. Once again, just looking for any kind of ulcerizations or cancer lesions. That also tested the hypoglossal nerve, cranial nerve number 12. Everything looks good. So now we're going to finish up with our cranial nerves. I'm going to test cranial nerve number 7, the facial. Can you smile for me? Puff out your cheeks. Good. And then we're going to finish up with cranial nerve number 11, the spinal accessory. So just go ahead and shrug your shoulders against my hands. Great. So now that we're done with the mouth, I'm going to go ahead and move on to the neck. I just want to make sure first and foremost that the trachea is nice and midline. We're not deviating with difficulty of the respiratory system or anything like that. I'm going to go ahead and palpate the patient's thyroid. So I'm going to stand behind the patient, place both hands on either side, and ask the patient to swallow. Great. Noting any kind of tenderness, enlargements, nodes that I find abnormal. So now I'm going to go ahead and palpate the patient's lymph nodes. We're going to start with the preauricle, the postauricle, the submandibular, submental, the cervical, post-cervical, the supraclavicular, and I'm going to go ahead and move on to the axillary at this point. Checking for any kind of tenderness, enlarged nodes, swelling, anything like that that could be abnormal. While I'm here, I'm going to go ahead and test range of motion and muscle strength of the neck. So if you can just touch your ear to one side and to the other, look down for me, and look up. Great. I'm going to test the muscle strength, so just move your head against my hand. Great, and the other side. Awesome. So now that we're finished with the head and neck, I'm going to check the carotid before I move on to the posterior chest. So first I just want to palpate each carotid pulse, making sure once again that we're 2+ normal. I'm going to do it one side at a time. Good. Great. So now I'm going to listen for any kind of carotid bruit or whooshing sound. I'm going to have you take a nice deep breath in, let it out, and hold it, okay? Whenever you're ready. Hold it. Great, and we'll do the same thing on the other side. Good. No whooshing sounds or bruise noted. So now I'll go ahead and have you turn around for me. We're going to move on to the posterior chest. So first and foremost, I'm just inspecting, perfect. I'm just inspecting any kind of labored breathing, making sure the chest rises nice and evenly. I'm going to check chest expansion now. I'm going to place both of my thumbs next to each other, have the patient take a nice deep breath in. Good, and watch my thumbs rise and separate evenly. Perfect. While I'm back here, I'm going to go ahead and test for any costovertebral angle tenderness, CVA tenderness. Any tenderness here?
No.
Great. I'm going to go ahead and palpate for tactile primitives, so say 99.
99. 99. 99.
One more time.
99.
Great. So now I'm going to go ahead and percuss over the entire lung fields. I'm listening for resonant lung sounds. Any kind of dullness heard could signify fluid in the lungs, and any hyperresonance may mean an overexpanded lung like COPD or asthma. And I'm just going to move down in a ladder-like motion. Great. So now I'm going to go ahead and check diaphragmatic excursion. So take a deep breath in for me and hold it. Checking till we get to that point of dullness. Perfect. Now do the same thing. Take a deep breath in, let it out, and hold it. And I would measure between the two areas. So now we're going to go ahead and auscultate his breath sounds. Listening for any kind of adventitious sounds like wheezing, any bronchi, crackles. So just take some nice deep breaths for me. Great, I don't hear any adventitious sounds at all. Now we're going to go ahead and listen for bronchophony, egophony, and whisper pectoraliquy. So go ahead and say 99 for me.
99. 99. 99. 99.
And say E.
E. E. E. E.
Good. All right, so we're finished with the posterior chest. I'm going to have you turn around to the front and we'll do the anterior chest. All right, if you can just let down your gown for me. Perfect. So once again, I'm just first going to examine the thorax, making sure that there's a nice even chest rise and fall, no labored breathing, no retractory muscle usage, signifying any kind of labored. I'm also checking AP diameter, making sure it's normal, that the patient doesn't have a barrel chest. So now I'm just going to palpate for any kind of thrills or heaves with the ball of my hand and the pads of my fingers. At this point, while I'm here, I can go ahead and palpate for the point of maximum intensity. This patient's fairly thin and in a healthy condition, so I can feel it really well. If for some reason I suspected an enlarged heart, I may have to move away from the midline to palpate that at the apex of the heart. So now we're just going to do, I'm going to go ahead and percuss the anterior lung fields. Once again, listening for those resonant percussion sounds. Great. So now I'm going to go ahead and take a listen to the breath sounds. Just take some nice deep breaths for me. While I'm here, I'm going to go ahead and listen to lateral breath sounds as well. Perfect. Good. At this point, I'm going to have the patient lean slightly forward just to pull that heart towards the anterior thorax. And I'm going to listen for heart sounds at the second intercostal space right of the sternal border at the aortic, second intercostal space left sternal border pulmonic, the third intercostal space left sternal border, fourth intercostal space left sternal border at the tricuspid, and then finally at the fifth intercostal space midclavicular line at the apex of the heart or the mitral. Making sure that I just hear a strong S1, S2. Great. At this point, I'm going to have him continue to lean forward and go ahead and flip to the bell of my stethoscope, listening for any kind of murmurs from the base to the apex of the heart. Great. No murmurs heard. So we're going to go ahead and move on to jugular venous pressure. So I'm going to have you lay back. I'm going to lift the head of this bed to 30 degrees, okay? Okay, go ahead and lay on back for me. Put these out under your feet so you're comfortable. Great. To check for jugular venous pressure, I'm going to have the patient turn his head slightly towards the left while I'm looking at the right side. I'm just looking for the highest point of the meniscus of that external jugular vein. I'm going to place my centimeter ruler on the sternal angle and place something flat like an index card right at that meniscus, measuring straight across. And his is normal. It should be about 3 to 4 centimeters above the sternal angle. Great, so now I'm going to lay you all the way back and we're going to move on to the abdomen. So first I'm just doing a general inspection, making sure that there's no bruising around the umbilicus, making sure there's no visible peristalsis or pulsations, looking for any kind of masses. I do note that the abdomen is concave. This patient is fairly thin, so that's normal. So now I'm going to go ahead and move on to auscultation of bowel sounds in all 4 quadrants. His bowel sounds are nice and active. Now I'm going to go ahead and move on while I have my stethoscope in hand and listen to the aorta and the femoral arteries, checking for any kind of whooshing or bruise. Okay, no bruits were auscultated, so I'll continue with my abdominal assessment. So first I'm going to go ahead and percuss over the abdomen systemically, listening for tympany as well as dullness over any of the organs or even a full bladder. Everything sounds great. So now I'm going to start right of the umbilicus, percuss upward to the bottom liver border, and then I'll go from the mid-clavicular line just under the nipple down to the upper liver border. Just wanting to measure that liver span. Good, and I'd mark there. Great. I can also go ahead and move over to the spleen, percussing for splenic dullness. Great. So now that I've percussed, I'm going to go ahead and move on to palpation. We're just going to start with a live palpation of the entire abdomen. Once again, checking for the patient grimacing, noting any signs of tenderness, feeling for any kind of masses. Good, everything feels great. So now I'm going to move on to deep palpation. I'm going to place my left hand under the patient's back, have the patient take a nice deep breath in and relax that abdomen as much as possible to palpate for that liver. Good, and it should be nice and smooth as his is. So I'm going to go over, place my left hand once again behind his back, my right hand at the upper left quadrant, palpating for that spleen. I can't feel it, which is normal. I'll move down to the left kidney and the right kidney in deep palpation. Once again, just checking for any kind of tenderness or anything that could signal infection. Everything looks great in the abdomen, so we're going to go ahead and move on. While I have the patient supine, I'm going to go ahead and have him raise one leg at a time and dorsiflex the foot. This is simply just checking for any kind of herniated discs in the back. Same thing on this side. Good, any pain there? Great. So now I'm going to go ahead and move on to range of motion of the hip while I have him here. So we're just going to test, relax your leg for me, flexion, abduction and adduction, internal rotation and external rotation, and that all looks great, and we'll do the same thing on the other side. So we're looking at flexion, extension of the hip, abduction and adduction, internal rotation and external rotation. And I'm going to go ahead and do the same thing with the knees while I'm here. So we have flexion of the knee, internal rotation and external rotation at the knee, and extension. Great. Making sure that none of his joints hyperextend. We'll do the same thing with the right knee. Flexion and extension, internal rotation and external rotation. So now I'm going to move on to range of motion of the ankles. I'm going to have the patient dorsiflex the foot and plantar flex the foot and test muscle strength at the same time. So go ahead and pull your toes up against my hands. Great. And then push them down to the floor against my hands. Awesome. All right, so I'm going to go ahead and have the patient sit up. We'll continue with our range of motion of the shoulders. So can you bring your shoulders out? And this is abduction. Good. Bring them across for me, adducting the arms. Great. Put them behind your head, looking at external rotation, and behind your back, looking at internal rotation. Great. Now relax them down. Now I'm going to test range of motion of the elbows, and I'm also going to test muscle strength at the same time. So can you flex your arms against my hands, and don't let me pull them down? Great. And then go ahead and extend those arms. Awesome. So now we're going to look at the wrist. I'm going to have the patient pronate and supinate the hands. So can you just flip them like this? And now do it really quickly. Good. Just testing cerebellar function with rapid movement at the same time. Let's look at the fingers and the knuckles. Great. So now while I'm here at his hands, I'm going to go ahead and continue muscle strength. I'm going to test his grip strength, looking for any kind of muscle weakness. Just squeeze as hard as you can. Great. Noting any signs of atrophy. Now I'm going to have you open your hand like this for me. Great. I'm going to do some neurosensory checks, once again checking for cerebellar function. I'm going to do number identification first. Can you close your eyes? Tell me what number I draw in your hand.
3.
Great. Keep your eyes closed. I'm going to place an object in your hand. Can you close your hand and tell me what that object is?
Key.
Perfect. You can open your eyes. That's diagnosis. Once again, checking cerebellar function. So now we're going to check some point to point. So I'm going to have you open your hands for me, close your eyes. Whatever finger I touch, can you touch your nose with it? Great. And one more. Okay, you can open your eyes. And we're going to do point to point of the lower extremities as well. Can you run your heel up and down your shin on each side? Great. Awesome. While I'm looking at the lower extremities, I just want to make sure there's no varicose veins. Once again, checking hair distribution, making sure color looks really good. So now we're going to go ahead and continue checking our pulses. We've done the temporal, the carotid. So now I'm going to move on to brachial, making sure they're 2+ bilaterally even. Radial. I'm going to check popliteal with both hands. Good. Posterior tibialis and dorsalis pedis. Great. While I'm down here at the toes, I'm going to continue cerebellar function. I'm going to do what's called proprioception. Can you just look forward for me? I'm going to move your toe. Tell me which way I move it.
Up, down.
Great. So now I'm going to go ahead and check the patient's reflexes. We're going to start with the triceps reflex. Just relax your arm in my hand. Good. Same thing on this side. Relax it. Good. Go to the brachial radial. Just relax it completely. Good. I'm going to move to the knee. Great. And then finally checking the Achilles. Good. So from here I'm going to have the patient stand up. You can put your gown back on if you'd like. So first we're just going to test for ataxia, testing the patient's balance. Can you stand there, close your eyes for me? Good. You can open them. That's the Romberg's test. I want to make sure that the patient doesn't lose balance. Can you bend over and touch your toes as much as possible for me? Go ahead and scoot up for me too. Great. So I'm just checking the patient's spine, making sure it's nice and midline, that there's no curvature of the spine as in scoliosis. Checking the SI joints while I'm here. Making sure there's no tenderness over the spine as well. Lift up at halfway, and we're going to do the same thing, making sure it's nice and midline and no tenderness. You can stand up all the way for me. So next I'm just going to check the patient's gait. I'm going to have you turn around and you're going to do what's called tandem walking, which is just heel to toe for me, just right back here for me. Great. Looking at muscular control and strength, come back on your toes and your heels. Great, everything looks wonderful. That's the end of our head to toe assessment today. Thank you.